conflict is affecting health workers now. This is what's happening there in the Middle East. I'm joined by Claire Waterhouse, who is MSF Head of Operations Support Unit. Claire, thank you so much for making time for us this afternoon. So Gaza has entered the third day of the ceasefire. From the information you have, what difference has this made, for those administering humanitarian aid, but also those, giving some health support?
Hi, Clement. Thanks for having us today. So it's day 3, as you said, and obviously after 6 weeks of intense bombardment, it is a respite for our colleagues who are there, for patients who are there, for civilians who are there. But with the infrastructure and health system as completely collapsed as it currently is, the situation is still fairly catastrophic. And of course, a 4-day respite from this bombardment is not enough. This pause isn't really enough time for us to be able to make a huge difference, get things back up and running, that kind of thing, especially when there is the threat that it will begin again after these 4 days and plunge people back into the exact same situation. So, of course, we're relieved that there is some respite for our colleagues over there and for the patients and just civilians in general, but we're very concerned about what comes next, particularly given that the health system is really barely functioning. I think not functioning at this stage. It's a very, very dire humanitarian situation at the moment. There has been some aid allowed in at the moment, so I think that the deal allows for 300 trucks to go in, but it's important to note that that's less than half of what was entering Gaza pre-October 7th daily. The situation in Gaza was bad before October 7th. It's now beyond imagination. So 300 trucks, of course, we're grateful for anything that gets in, but it's a drop in the ocean compared to what the needs are. Yeah.
How have the doctors themselves been managing? I mean, one wonders, the kind of trauma that they are exposed to and how they deal with that.
Absolutely. They are some of the bravest people I can imagine in my life, but they are also human, just like any of us, and they are mentally, emotionally, physically exhausted, absolutely at the brink. I think they've seen things and had to deal with things that none of us can even begin to imagine dealing with in our lives, let alone in such a short period of just 6 weeks. The intensity has been nonstop. They are working nonstop, and it's truly terrible to think of what they're going through and also to not be able to support them in the ways that we normally would want to and would be able to. We're very concerned. We are working hard to support them in every way possible, and I think it speaks to their dedication and passion that some of them have decided to stay in the north of Gaza despite knowing the risks, knowing what could happen, but they believe so strongly in what they're doing and supporting patients that they are staying. But it has not been without a toll on their physical, mental, emotional health at this time, and it's very difficult.
So the danger with the war, whether we talk about the continuing ground offensive and the airstrikes on the hospitals, the ambulance convoys, is that the situation becomes dangerous even for journalists who are supposed to tell the stories and humanitarian aid workers and the doctors. So are there still enough of your staff members on the ground to assist those that are remaining behind, those that are not evacuating as per the calls by Israel? Yeah. So they're staying in spite of those attacks, even on the hospitals?
Yeah, the short answer is no. There's not enough of anything at this stage, but there is a huge human resources shortage. There's not capacity for us to meet the needs that there are. There are so many severely wounded people, civilians, who are just not able to get the care that they need, and that's obviously partly due to the complete infrastructure collapse, but also because there's not enough people on the ground. And of course, we can never expect anyone to stay in the north. We are not pressuring anyone to stay in the north. Many of our colleagues have fled south with their families to try and keep safe. But the issue then is that we are really struggling to get more people in. We were very relieved about 10 days ago. We managed to get a new team of 15 specialists in, so surgeons, anaesthetists, real specialists into Gaza. That's an international team from all over the world who've come in. But unfortunately, they cannot access the north because there's absolutely no guarantee of their safety, and we are unable to get that guarantee in any way. So without those guarantees, they are also in the south, so they're doing everything that they can to support from the south, to coordinate activities in the south of Gaza, but getting them to where they're most needed is critically important for us. And that's why, I know we're in this pause right now, but we maintain our call that we need a sustained ceasefire, a proper cessation of hostilities, so that the health system can come back online and try to just they are. But at this stage, that is not happening, and it's extremely concerning for us because, well, the situation, as you know, the situation is truly terrible.
Yeah, I mean, one wonders how many health facilities are still there. Are there even enough hospitals now to respond to the demand in healthcare? Because it doesn't help that hospitals having been spared from the attacks in this war, and even significant things like fuel are actually running out.
Yeah, I think it's safe to say that the entire health system has absolutely collapsed. There's almost no functioning health facilities left in Gaza, extremely few in the south. If they haven't been attacked or bombarded or put under siege, they don't have, as you mentioned, they don't have fuel, they don't have water, they don't have electricity, they don't have food, they don't have basic medications. It's impossible to run a health system like this. We are doing our absolute best in every way that we can, but it is not enough. We are, the limited amounts that we've been able to get in on the various agreed moments when things have been able to cross the border, they barely touch sides. And the health system as a result it's destroyed. There's no other word for it. And that's frankly unacceptable. The rules of international humanitarian law are extremely clear on not targeting health facilities, not targeting civilians, not targeting patients, not targeting healthcare workers, and those appear to have been thrown out the window at this stage.
And of course the justification for that, sometimes from Israel, is that, well, the Hamas fighters themselves are hiding in the hospitals. They're using the healthcare workers and civilians as human shield. From the information you have, having spoken to some of your own workers at the hospitals, what's the situation like, and how do they respond to these claims by the Israeli Defense Force? Because that's often what they use to justify even going after those hospitals, that they should be, as you said, according to international law, they should be staying clear of.
Yeah, we have heard those justifications, and in our time in those hospitals, or in the hospitals where we have worked, so I think Al-Shifa has been a primary example used for this, but in the time that we have been working in that hospital, which is many years now, we've not seen any evidence for that. We have not, our staff have never reported any concerns like that, have never witnessed anything like that. And in all hospitals we work in, this is global for us. It's not just about Gaza. We do not allow weapons in. We do not allow military uniforms in. So those are very strict rules that we have about our hospitals, and that would have been in place in Al-Shifa until, still is in place. Obviously, it's almost impossible to enforce now with the given situation. So I really can't speak to those justifications. I'm aware of them, but from our experience on the ground, we have not seen evidence of that, and it would be impossible for us to make a statement one way or the other. But certainly from our experience, we have not seen any evidence of that.
How different is this conflict from the others that your doctors have worked at?
Conflict is always difficult. It's always tense. There's always a lot happening. I've worked in several conflict zones as well, and it's never easy. It's always extremely complicated. And it's not like this is the first conflict where we haven't where we've seen international humanitarian law not being fully respected. But I don't think that we've ever seen it to this extent and had this level of concerns for health facilities and for our staff. In the last week alone, we've had 2 incidents of being attacked. We were moving a convoy of our staff and their families from the north to the south last week. I think it was Sunday or Monday. That convoy was attacked despite us communicating the route to all warring parties, being in very clearly labeled cars, leaving from a very clearly labeled MSF clinic. It was still attacked, and very tragically, we lost a family member of one of our staff in that attack. And not even a day later, there was an attack on another hospital called Al Auda Hospital in North Gaza, where we work, where 2 of our doctors were horrifically killed in an attack. And again, we communicate literally everything that we can about our locations of our clinics, our hospitals, our homes, where people are staying, our cars. All those things are communicated to all parties. There's no one that we don't speak to, and yet we still are seeing that we're coming under attack. I think 5 of our cars have been destroyed in this, and they are very clearly, they say who we are. So in that sense, we are struggling. It's this level of not respecting international humanitarian law is severely hindering our ability to be able to respond. The levels of civilians being attacked as well, we have not seen that in a very long time.
Well, Claire Waterhouse, thank you for making time for us this afternoon.